Now is the opportunity for you to reflect back and ask questions of members of our panel. But before I invite you to do that, I'd like to ask members of the expert reference group to comment on the Partners in Recovery initiative, problems it's likely to address and what they hope it's likely to achieve. So could I invite Alison Ritter to comment first, please?
Thanks very much. I think everyone knows what the problem is about people falling through the gaps, services not being well coordinated. And from a drug and alcohol perspective, I think probably the 24,000 people that are the target group for this initiative have at some point access to drug and alcohol service. And from drug and alcohol services point of view, the problem has been that clients are bounced between drug and alcohol and mental health. There's no coordination. The client might fail to attend after a couple of sessions. The alcohol and drug service has no way of locating that client. They don't know that they've necessarily been well picked up by a mental health service and so on. So really this initiative is about trying to coordinate the care for that person over a long period of time, not just in an immediate episode, but over the course of some appropriate period of time.
Janet Ma, you've used mental health services, you understand very much the situation of people with severe and persistent illness. What do you hope that Partners in Recovery will achieve?
Well, I hope it helps us recognise those people who fall away from our services for various reasons, usually their own conflict, and that we'll be able to pick up those people again and help them move towards recovery. We're not talking about the nice consumers generally, we're talking about people with very complex social and emotional difficulties, and often people who don't recognise that it's a mental health problem underlying their plethora of social problems and their disassociation sometimes with our communities.
Thank you, Janet. And lastly, Karen Price from the Ministry of Health.
Thank you. Yeah, I think Partners in Recovery is a significant opportunity for us all, and the additional resources are welcome. I think relationships and the system navigation and the value add all will probably come through really good and solid efforts at understanding the local pressures, the local resources, and working together to try and address those challenges that already exist and will exist when this initiative kick off.
Well, I think we've had a good overview and a large set of aspirations and some things to watch out for to stimulate your questions. So now it's your turn.
My name's Natalie Healy. I'm representing Inner West Sydney Medicare Local. I'm a mental health nurse. I'm just interested to know what your vision is around the support facilitators. Who might that be and where might they sit?
So the guidelines talk about the role of the support facilitators being, I guess, the day-to-day people doing the system level collaboration and the contact with clients. We've been deliberately silent again on any qualifications or training that the support facilitators might have, and that's because we want to allow as much flexibility as possible within the models that regions are proposing to make sure that the skills and qualifications match what's needed. So I think we talk about them being appropriately skilled and experienced, but we certainly would envisage them to have some core skills, you know, like a good understanding of the mental health needs within that region. They'd need to be good communicators and networkers, and those sort of, you know, embody those recovery sort of skills. It might be that the support facilitators are actually based within the PIR organisation, or there might be models recognising that some regions are quite large, that support facilitators are sort of outposted around the region. So there's certainly flexibility for that.
Good morning, Desley Casey from Can Matter Health, and I was wondering whether the Partners in Recovery are developing a minimum data set for the data collection overall, or are you just giving guidelines on what data you want collected as part of the evaluation component?
The evaluation design has yet to be finalised and the tendering process is still active. But yes, there will be a core set of data that will need to be collected by PIR organisations in order to inform both service monitoring as well as the overall evaluation.
Hi, my name's Jessie Dunphy. I'm a peer support worker and I also work within the service development team at NEMI. Just thinking about referral pathways and thinking about some of the difficulties we've had around sort of the term serious mental illness. And I just wondered, whether there'll be a clear definition around the idea of this being for people with sort of a severe degree and persistent, how we'll clarify that in terms of referrals.
If you check the website, they refer to a document that was produced by the National Mental Health Consumer Carer Forum, which is entitled Unravelling Psychosocial Disability. And it doesn't come up with the definition because the definition is in the individual. The individual, you could live with a serious and persistent mental illness and be quite productive and not truly have a psychosocial disability. And someone with an equivalent disorder could be absolutely, totally socially dysfunctional, personally dysfunctional and physically unable to manage their affairs. So it is one of those areas where expertise is in the interpretation of the individual.
How self-directed is it aimed that the PIR action plans will be in terms of working with people?
The answer is very. It's envisaged that the support facilitator will sit with the client, their family and carer, if they're available, as well as or partner organisations, if possible, and work through what the needs are. The partner organisations may not necessarily all be there, or any of them may be there at the time, and then the role of the support facilitator would be then to go away and negotiate with them about what services they can provide, when and how and what have you. But it is envisaged very much that the client is at the centre of this and has to be involved in the decisions about what they need. And as I said in the presentation, it's envisaged that they will also sign the action plan and get a copy.
Hi, Michael Mitwallen from Anglicare South Western Sydney. With the funding that's allocated to a region, does the department have an idea or a proportion that it would allocate from that total amount of funding for organisations to use for those types of services? We'll
go through the funding in the next session, but the funding is split into two types. There's one-off funding, which is just to establish the organisation, and the remainder of the funding is the recurrent funding to support the operations of the organisation, and that we don't specify at the moment what proportion of that operational funding should comprise the flexible funding. But we are in the process of thinking about how we might give some further guidance about that in the invitation to apply documentation.
Jenna Bateman, Mental Health Coordinating Council, New South Wales. My question is one about the National Disability Insurance Scheme and how these two programs dovetail. Particularly, I guess I hear the terminology of support facilitator, and I'm aware that that's also a role within the NDIS when it rolls out. And the target group is similar, at least part of what is envisaged to target under the NDIS. And I just wondered if there was some thought around that.
Actually, it's a good question because it is a similar target group, and my vision for this is that part of the coordination would be to coordinate with disability support services and to facilitate access to broader supports if necessary via the NDIS.